Clarence Nishihara says he's made a full recovery after being diagnosed with COVID-19 in mid-March. He also has a message he'd like to share. Jen Boniza reports.
Senator Clarence Nishihara falls into the high-risk category for COVID-19, yet he beat the virus. In fact, he says his symptoms were so mild he didn't have a clue that he had it. He hopes that sharing his story will help people realize that while the disease is serious, it's not necessarily a death sentence.
I guess I'm lucky.
Lucky. That's how Senator Clarence Nishihara feels more than a month after beating COVID-19.
A 76-year-old guy and has diabetes and probably, I don't know what else, but anyway. So I would be I guess a classic kind of patient that they would be worried about.
But he says he's completely recovered and feels fortunate to have had only mild symptoms.
I had fever, lasted about 4 days, maybe went up to 102.
That was February, before the disease was widespread. He went to the doctor because he had an upcoming trip to Las Vegas planned.
He did check me and said, I have some kind of a flu, but he didn't say I had the COVID or anything.
Nishihara says he felt better a few days later, so he went on his trip.
After I came back, I still had my cold.
So he got tested. It came out positive.
I was still surprised because I didn't think I had the symptoms.
He quarantined in his bedroom for 14 days. He says that was the hardest part. Now that he's better, he has a message to share.
We shouldn't minimize the danger of the disease because it really is a dangerous disease. The disease, as very bad as it is not a necessary death sentence.
When I spoke to Nishihara today, he was on his way to donate plasma to help those currently battling COVID-19. He's also waiting for the results of his recent antibody test. Jen Boniza, KH12 News, working for Hawaii.